I've been now at University of Utah for 3.5 years. This is a really exciting time to be Dean of the University of Utah College of Pharmacy. I just feel so grateful to be surrounded by and inspired by such an amazing group of faculty and students and preceptors and alumni, all just doing really amazing things and advancing our missions and championing excellence in all the areas that we are interested in. The college, the US News and World Report just released its ranking for colleges of pharmacy, and our college is ranked 14th in that ranking, which is really wonderful out of more than 140 colleges across the country. And that's really just a reflection of the reputations of alumni like all of you, and also the reputations of our impactful faculty and student activities that are going on right now. And so I wanted to just give you a few brief highlights and then field any questions that you might have. So of course, our core mission area is around education. When a lot of other colleges of pharmacy have expanded their classes quite a bit, we've kept our classes quite small, usually between 50 and 60 students per year. And so we have just shy of 240 PharmD students in the program right now, and about 50 students that are PhD candidates. We are in about the third year of a fairly major overhaul of our curriculum, which had, we felt, been a little focused on didactic learning, on memorization, and preparing for tests. And this curriculum redesign is a pretty significant change that focuses on higher order skills, problem solving, knowledge creation, communication. We spend a lot of time working in small groups, recitations, and really even one-on-one with students, helping them become leaders in their fields and problem solvers in their fields. One of the hallmarks of our curriculum now is a required PharmD project, which is a project that students select an individual mentor from the faculty or from among preceptors, and they work over the course of 2 years to solve a real world problem that's of interest to them and to their mentors. The caliber of these projects is really high. We expect them to be publication quality, and many of these, more than half of these projects go on to become a publication in a peer-reviewed journal or a presentation at a national meeting. I think it really enabled us to make an emphasis around the fact that each of our students should leave here being able to solve a real-world problem and advance the profession in an impactful way. So that's really exciting. I think that's leading to our students being sought after for residencies and other kinds of jobs after graduation. You can probably imagine this has been a really interesting and challenging year with the COVID pandemic, to figure out how to teach and have clinical experiences while keeping everyone safe. And I think that's also going to lead to lasting changes in the way we conduct pharmacy education. Another research a mission area is research, and the college is doing really great on this front. We have a very strong research program that's been helped tremendously by having our new research building, the Ellis Skaggs Jr. Building. And we, in this past year, had $22 million of external research funds come into the college to support our research projects that have spanned a whole range of things related to pharmaceutical science, from environmental toxicology, looking at the impact of air quality on lung health, drug-drug interactions, discovering new antibiotics from the Great Salt Lake microbes, technologies for making proteins orally available so that protein therapeutics can be delivered orally, and even things like studying the biological underpinnings of violence through a project with the state prison. So a whole range of very interesting projects that are being supported. We have several fairly large projects as well, including a $10 million Department of Defense project focused on discovering non-opioid painkillers, a NIH funded Center of Excellence for discovering antidotes for chemical terror agents. Our AD program continues a longer than 40-year history of discovering new anticonvulsants, antiepileptics. And our Pharmacotherapy Outcomes Research Center remains one of the leading centers in the nation for doing pharmacotherapy outcomes researches. The pandemic has also brought some interesting opportunities to the college. Daryl Davis's group in medicinal chemistry had been working on antivirals for Zika and other flaviviruses. And they were able to demonstrate that these compounds that they're developing actually have quite potent activity against coronaviruses. And so received some federal funding through the CARES Act to develop those further. So lots of exciting things going on there. And then, of course, our third major mission area is clinical care. And we have 15 clinical faculty who are tremendous. They're on the front lines of patient care, which has been a really challenging year, as you all know, to be doing that. We have very close collaborations with University of Utah Health and with hundreds of preceptors across the state. Linda Tyler is our associate dean in the college and is also the chief pharmacy officer at UHealth, and is currently the president of ASHP, so National Leadership in Healthcare Pharmacy. And we have a number of really awesome community engagement activities that our students and clinical faculty engage in. And Karen will be telling us a little bit more about some of those in a bit, so I won't steal her thunder. But I hope that gives you a bit of a feel for what the college is up to. And if you have any questions, I'd be happy to try and field them. If not, we can go on to Karen. Okay, well, it sounds like Karen is up. If you think of questions later, give me a shout.
Well, excellent. Thank you, Dean Peterson. Just to give a little bit of more details about myself and kind of an example of what our clinical faculty are now doing. This is my 23rd year at the University of Utah College of Pharmacy, and I have been a clinical faculty member with an appointment in the Department of Family and Preventive Medicine during that time. And I spend 2 to 3 days a week at the Sugar House Clinic, the University of Utah Sugar House Clinic, which if you are in Salt Lake is a brand new, really shiny, really nice clinic right at I-80 and 13th East in Sugar House. And I am what is called, and this is kind of a funny name, but we call ourselves embedded clinical pharmacists. So I work alongside the family medicine doctors and teach the family medicine residents that are in the clinic about how to effectively use drug therapy, and also utilize collaborative practice agreements that allow me to prescribe medications, adjust medications, order labs for things like diabetes, hypertension, etc. So if you were a patient with diabetes that might come to Sugar House and you had some needs to improve the control of your diabetes, you would probably get referred to either me or one of the other members of our team there at Sugar House. In this regard, I think this is one of the huge rising areas in pharmacy is the expansion of what we call ambulatory care pharmacists. Ambulatory care is kind of a weird word because ambulatory just means walking, but really what it is pharmacists that exist outside of the hospital setting that are involved in the care of patients. And so right now I have a fantastic P4 student on a 6-week rotation with me. And we're teaching him the ropes of the ambulatory care area and how to treat some of the common disease states that we see. We also have pharmacy faculty at the ARUP employee primary care clinic and in several other clinics in the University of Utah Health System. So this has been our area of greatest expansion and actually great area of student interest because the ability to work, much like I'm sure many of you have, especially the people from more rural areas, work alongside providers really brings a lot of professional satisfaction. So we have a lot of students that are really interested in that. Of course, we continue with rotations also in our hospitals. And so we also have a great partnership with Intermountain Healthcare all around the state for inpatient pharmacy experiences as well as our University of Utah Hospital here in Salt Lake City. So students are spending their entire last year doing 6-week rotations in a variety of areas. And certainly with the pandemic, I had a virtual student. So the student could not come to clinic. Actually, I could not go to clinic during kind of the March to June time period. And so we were able to use telehealth. Some of you may have experienced that with your providers to talk to patients, to engage with our physicians that were working from home and to really bring the students into that experience. And so, certainly no one's dream experience is to be on a phone all day or to be in a Zoom meeting all day, but I think we really gave our students a good experience of what the potential of telehealth can be. And I think the university will continue with that in the future. Certainly there is a benefit when we have patients from rural areas that are coming to the hospital for specialty services. I think this telehealth has really caused people to think about what could be provided without so much travel and burden placed upon our patients that are coming from rural areas. So I think we'll see a lot of good changes and expansion of services that will provide great care without having a really long drive to Salt Lake City. So in terms of our community pharmacy experiences, we have great community pharmacists across the state that are providing experiences to our rotation experiences to our students as well. And the AHEC, so the Area Health Education Centers, are very strong in supporting our students. And actually, our students have some of the highest levels of rural engagement and rural rotations of any of the healthcare professional students in the state of Utah. So I think that's a real excellent focus of our experiential education program to get our students into rural areas. And I just started working on a new elective for our students to, it's an interprofessional elective to really give all sorts of healthcare professional students an idea of what working in a rural area is like and, you know, why this may be something that they might want to choose in the future. And I think we still do have quite a few students who choose to go back to their homes in rural Utah. I think we have pretty much educated the current generation of pharmacists in Delta. There was large numbers, Ryan smiling, there's large numbers of students from Delta that I think all that generation has all recently graduated. So in terms of our student engagement, I am just forever impressed with our students and their innovation and their drive to assist the community. And we have many, many, many events that the students are engaged in. Probably, many of you might have been involved in APHA, I saw a couple of those things in the document that Ryan was posting, but APHA is on steroids these days. It is huge amounts of student involvement and things like immunization drives, Operation Diabetes, for which our students won a national award in 2019. They were deemed the best chapter in APHA in the country for providing services to our community in terms of diabetes education and outreach. Our students also are involved in free clinic work, and which right now has kind of been put on hold, but we hope to start that up in the future. So there's 2 clinics in the Salt Lake area that provide free care to uninsured and underserved patients. And so our students are involved with the med students and the PA students and nurse practitioner students to provide that care. So they are busy. They are doing the new curriculum, which involves, as Dean Peterson said, a lot more engaged learning in small groups. And they're also involved in these activities. We call them co-curricular activities, but they're activities to serve the community. And I know, I think one of you might be from Blanding. I know our students love to go to Blanding. There's an exceptional rotation at the Navajo Native Health clinics down there, and it's just been an amazing experience for our students. And it's also, I think, served the community of Blanding because we've had many students who've then gone to work and hopefully stay in Blanding. And that's really the goal that we would have for that. Let's see. So the other thing, and I don't know if people have questions about the status of being a pharmacist in general in the state or in the country. So has anybody heard things about pharmacy in general, jobs going up, jobs going down? That's typically something that we follow really closely. And a positive news that just came out in the past couple of days, a new report from the Pharmacy Workforce Center that in 2020, for clinical pharmacists, Utah had actually the second highest rate of number of jobs per 100 per thousand, not 100,000, per thousand licensed pharmacists in the country. And so I think this speaks to the level of pharmacy services that are going on in Utah and provides a great opportunity for our students. There have been decreases in pharmacy jobs, but what was really interesting to me is that the West and Utah in particular has really maintained job opportunities for students. And that was something that I was feeling, but that this survey kind of supported. There is a shift though. There is a shift from retail positions to clinical positions. And I actually would prefer to say that clinical is not a place, it is a way of being. And so, certainly there are clinical pharmacists and community pharmacies all across our country and across our state. And that's one of the things we're actually working on is looking to hire a community pharmacy faculty member that can bring some integration of clinical pharmacy and do some advocacy for the profession of pharmacy in our state from the perspective of a community pharmacist. So that's something I'm really excited that we're working on. I can talk for a really long time, but I won't. But I would love to hear questions if people, have questions about some of the careers that our students are going into. About half of our students are going on to do clinical residencies, so at least one additional year in a area of pharmacy, including community pharmacy. And so I think they're choosing not to just end their education at their PharmD, but continuing it afterwards. So happy to take any questions or engage in discussion. And I'll just stop.
No questions.
You're like a group of pharmacy students that I just taught, which is totally fine. We have found the Zoom teaching to be kind of a challenge.
Karen, I have one question.
Yeah, absolutely.
if they go on for that extra year, does that mean 7-year program or
So usually what happens with the
total?
extra year of residency kind of depends on how many years it takes them to do their pre-pharmacy work. You know, we don't require an undergraduate degree. And part of that comes from the fact that we get really amazing students from places like Snow College, from Salt Lake Community College. And so requiring a bachelor's degree has not been something that we have done. So you may have students that have a lot of AP classes or IB classes that complete their prerequisites in a shorter period of time. And then they would do 4 years of pharmacy school. And then they would do 1 to 2 years of residency afterwards. So yeah. So I actually, it's a little bit better. When I was a student, I'm actually a graduate of Oregon State Bachelor of Pharmacy program. And then I did a 2 year postgraduate PharmD here at the University of Utah. And then I did a residency. So I think the path is a little bit clearer now for our students, versus, having both a bachelor and a PharmD and having to move around.
Okay, thank you.
Absolutely. One of the other
Right?
things, oh, Maria.
Oh, no, go ahead.
One of the other things that you may be interested in is we do train all of our students to deliver immunizations. We just completed our first year class training, which was interesting in pandemic days, about a month ago. And I have been just reading in the paper this morning, there's a discussion about the COVID vaccine dissemination plan. And of course, pharmacies are very hopeful that they can be a part of that. And I think after the first wave of vaccine, which will probably be controlled by the health departments, that there will be a lot of pharmacist engagement and pharmacy engagement in COVID vaccine administration. I'm also on the board of pharmacy for the state of Utah, and we have received authorization through rule that pharmacists can administer the COVID vaccine. So that required a change to the administration rule, and also have created rules with the Department of Health that allow for pharmacists to administer COVID testing. So there's a few pharmacies in the state of Utah that are doing COVID testing as a part of their care for patients.
Karen, are those mainly in rural areas? The pharmacies that are,
COVID testing, actually, the ones that I know about are in Taylorsville. So CVS as a corporation has really worked hard to try to increase access, but there was not a limitation of where this could be done. So if there needed to be testing sites opened up in rural areas, there wouldn't be a limitation on what pharmacists could be involved. This is, of course, the patient administered test. So there's not, a significant risk. The pharmacist teaches the patient how to do it. The patient rolls up their window, does it in their car, and hands over the specimen. And the University of Utah has actually been pioneering in the role of saliva testing for COVID. And so that represents, another method that is a lower risk to anyone that's administering, but also is much more comfortable for patients. So that hasn't reached pharmacy testing yet, but I suspect it will.
Karen, I just have one question, and maybe you addressed it, because my I hear my signal keeps going in and out. But on the testing, are these um, um, the pharmacies there are going to be doing or be involved in testing? Is the pharmacy going to be doing the testing in self-administered testing?
So the pharmacist will instruct the patient on how to do it, and then the patient will be doing the test themselves, versus put the swab to reach your brain
Themselves.
Testing. Yeah,
Yes.
yeah. So it's patient self-administered. And I think what CVS is doing here in Salt Lake, and I know Arizona, is that they are doing that all through their drive-throughs. So they're instructing the patient through the drive-through system, and then collecting that sample afterwards. And then I'm fairly certain for most of them, it's a send out lab. And so it would be, the 24 to 48 hours to get the results back for the patient.
And the turnaround time?
Usually 24 to 48 hours. We've had really good turnaround times in the state of Utah, not the kind of, 5 days, 7 days that sort of make the test less desirable. So I haven't heard long testing times from anyone in the state.
Well, great. Thank you, Karen and Dean Peterson, for both of those updates. We really appreciate that. We do have a short video. If I know a good share of you have been through the building, but we also, this summer, we made a video just for our incoming students, and it's also very appropriate to show to folks that haven't been in our new research building as well. So, but it's been open now since 2013, so it still doesn't, it still kind of has that new luster, but it's been our home for pharmacy research for the last 7 years. I'll go ahead and start that.
Hi, my name is Ryan Boyack. I'm the development director here at the College of Pharmacy. I've been here the last 10 years, and welcome to the College of Pharmacy. What we have, we're in between two buildings. One is a research building, which is named the L.S. Skaggs Junior Pharmacy Research Building, and this was built in 2013. And then over here to the north, we have the L.S. Skaggs Hall, which has been the home of the College of Pharmacy since 1965. Mr. Skaggs, as a philanthropist, pharmacy education was very important to him. And with his drugstores, he wanted the best pharmacists working for him. And so he invested in College of Pharmacies throughout the West. His gifts to the college really has made what the College of Pharmacy is today. And we wouldn't be a leader without his help. Where we're standing in here is the atrium of the L.S. Skaggs Pharmacy Institute. What's unique about this is it doesn't look like a research building. It really is warm and inviting. It is kind of a central meeting place of the College of Pharmacy. What's neat about this building is the colors in it, the floor. It's different than your all cement lab space research building. Now the design of it is there's 3 bays on each of the floors. The real innovation of the building where all the connections are up in the ceiling. They can change the configuration around. They're not necessarily tied to the ground. And it really is best in the nation, really state of the art for pharmacy research. This is the sterile compounding area. In this area, they try to mimic exactly a clean room of what you would find in a hospital. And then over here, we have the compounding lab. This is where students learn the art of compounding. There's the Poison Control Center. Our students have the opportunity during their 4th year to do a rotation through here. And right now it's also where the COVID-19 hotline for the state, they're answering all those calls right now. The Poison Control Center can always be accessed. Someone is here 24 hours a day. The Department of Pharmacotherapy is up on this 4th floor, and this is where a lot of our clinical faculty have their offices. The clinical faculty really are experts in their field. Each of them do have a specialty or a community pharmacy that they are helping to run, where they're working as a clinical pharmacist in that clinic. But then the knowledge that they have and treating patients, they're also spreading that knowledge to our students as well. The strength of the College of Pharmacy lies in our alumni. We've had about 3,500 alumni that have gone through our program here. And each of them are very competitive in the pharmacy field just because of the education that they received here at the University of Utah.
Thank you for allowing us to give you some updates. Now we'd like to hear some updates from yourself and hear about what you did in your career and where you are now, and what you're doing to stay busy in life. And if we could start with Scott, that'd be great.
Okay, thank you. Good morning, everyone. I was trying to anyway, it's good to see everybody. I wish that there was more of our students or graduates here. I mean, after 50 years, it's surprising how fast we're old, and 50 years has passed. But I think as I think back of my experience at the university, and particularly the College of Pharmacy, was being there. And I think we were one of the first classes or couple down the line of graduating from the new building. And just the friendship and the interaction that we made with each other has been lifelong. And I mean, Steve Marshall and I of Pharmacy, and Dean Peterson, Dr. Peterson, and Ryan, and took us on a tour of the building, and it was really I did leave the Salt Lake Valley, and I moved to California. I did want a job at a hospital down in. Since I was from Utah, I would come down there and work for a year, and then I would move back to Utah. Well, that didn't happen. I did end up in a retail pharmacy in the city of Orange. I was there for 45 years, and so I did get settled down here, but I still feel like I'm connected to Utah, and I'm home. But I still feel like Utah is my home. I wish we all would be more connected with the university, and especially the College of Pharmacy. And they always feel like maybe they want money, and that's not the case. And I think to be involved and to see the growth and the programs Aaron's doing, and the growth of the about the graduate programs and things, it's really amazing. And I'm so hopefully next year we'll be in person, and I think we're going to combine a reunion, I guess, of the 50, our class, and maybe next. We'd like to connect, and I don't know whether we could even do a Zoom connection once a year or twice a year if it's too involved or expensive for the university, and to see what's going on. So anyway, I've enjoyed seeing the few of us that are here, and I'm glad that we're all upright and healthy. Thank you.
Hey, Doug, could we hear from you? Is that all right?
Yeah, and I actually feel like my career started 10 years ago down here in Southern Utah. Like I say, it come down to a whole new setting, the retail, not nearly the pressure. Education with our graduates from the University of Utah coming down. They've created a really good environment. How we connect, we've hired several. I was one of 4 pharmacists down here at that time. And since we've got 9 pharmacists now in the clinical program. They're doing super job. And like I say, the students that come down from the University of Utah have been a real addition to what's going on in the outside world. And it's been a great career for me. And like I say, the last 10 years, super.
Tell us where you are and where you're.
I'm in Southern Utah, which is the Four Corners area, which is basically the end of the earth. And like I say, there's not much down here, but like I said, it's the university. It's the Utah Navajo Health Services. We are a division we're a private company doing Indian health services. And it's we've got quite an area. We cover clear from Blanding, clear over to what they call Navajo Mountain, which is 250 miles away. Got 4 clinics, and like I say, 9 pharmacists, which most of them are clinical. They actually fill in all the retail areas too, but it's been super good, really good. Been a good experience. A lot better than the crash courses in retail up north. And I'm still working too, so. Which I probably wouldn't be if I was still up north. But yeah, that's the gist of my career.
Great. Thanks, Doug. Hey, Marilyn and Scott, if you just would like to give us a quick update about how things are going in Panguitch for you.
And Ryan, before
Marilyn
we
and Steve.
continue,
Oh, Steve. Yeah, sorry. Yes.
I wanted to bring to your attention, we have Roy Christensen. He just joined. I was on the phone with him. We were having some technical issues, but he's with us as well now.
Great.
Oops. Thanks for joining, Roy.
Okay, I'm here now.
Okay. Hi, Roy.
Yeah, go ahead, Roy. If you'd like to give us a quick update about where you are now and your career and what you're doing.
I just retired 2 years ago. I worked 47 years for, ended up with Kroger. Well, it's really been all part of the same company. Started out with Grand Central and then Fred Meyer and then Smith's. And so I just retired February of 18. It's been a great career. Now I'm just enjoying fishing.
And where are you located, Roy?
I'm in Magna, Utah.
Thank you for sharing.
You bet.
Show us a good picture of something you've caught recently.
Well, I just caught a good sized one a couple weeks ago. Weighed 4 3/4 pounds.
Ooh, that's a big fish.
Wow.
Still can't get it.
But I'm still water skiing too.
Their eyes go
That's
up.
impressive.
That's not too bad for 73. Can still slalom.
I couldn't do that at 30, so I'm impressed.
Hey, Richard, can we hear from you? Richard's, I don't know if everyone knows Richard Swinyard. He's the son of our second dean.
I graduated from the class of 1968. I started in the old building. At that time, they used to say that that was the only pharmacy school in the country with 2 swimming pools, because it was in the that area where the physical education department was. And, we were the pharmacy department was on the 3rd floor. But I'm grateful to be a part of graduating from the University of Utah College of Pharmacy. It was a great experience. I practiced pharmacy. I knew Sam Skaggs very personally. I worked for Skaggs companies for about 15 and a half years and left there and went with what was then SmithKline and French and became GlaxoSmithKline. And I did their contracting. And what was fun about that for me is I called on a lot of the pharmacy people I knew to do contracting with the companies they worked for. And I also called on a lot of physicians that I had gotten to know over the 15 or 16 years that I practiced pharmacy. but I'm retired now. I live in Holiday, Utah, and I'm just grateful to see some of these people at the college that I have met, Dean Randall, or Dean Peterson, and Ryan, and I certainly remember Karen, and I'm grateful to be part of that association.
Great, thanks, Richard. Next, Constantine, if you wouldn't mind sharing.
Good morning. Pleasure to see some of you. Don't know any of you, unfortunately. I'm a 1960 graduate, and like Richard, we are up on the 3rd floor overlooking the gym. Had some interesting, anyway, after graduating, I stayed for a year with Milton Matthews and did a master's in pharmacy administration. Then came to Oregon State and did a pharmaceutical sciences PhD. Stayed for 33 years, taught many outstanding students, Karen included, and had a great time. Retired back in '99. Went to work actually part-time as a relief pharmacist around town. But while in Salt Lake, I worked for Dan's Drugs and Sugar House Pharmacy and ZCMI and others that I can't remember. Anyway, it was a fun time. There were a bunch of us from California that went to school there, and I keep in contact with a few of the chaps that are still with us, and mostly in the Sacramento area and the Bay Area. But I keep in touch with many of my former students from Oregon State as well. So it was a good career, and I really enjoyed it all, and I'm still very active. I keep doing things with what is called Academy for Lifelong Learning. It's a continuing education for adults. Still involved in hospice, which I helped found here in town, and the theater community also. So it's fun. I'm having a good time, staying healthy, and thank you very much for the opportunity to see everybody. Thank you.
Your voice is bringing me back to Oregon State. Definitely. I did not recognize you, but your voice immediately, I knew exactly who you were. It's wonderful to see you.
Thank you very much, Karen.
Yeah, thank you, George. And
Thank
it is home right outside of where's home for you right now?
Corvallis, Oregon.
Corvallis. Yeah. Great. And then I think last, if we could hear from Dave Wienig, and we'll.
Yes.
Yeah.
Yes, I'm here. I'm up at Mirror Lake, Roy. This is my fishing spot. I still do that. My soul lives up here. I was on the admissions committee for a long time, and I enjoyed that. I've always enjoyed being in contact with the college. And if I had to do it all over again, I would. Some people look at me like I was crazy. I would. I have a grandson who is thinking about going to pharmacy college. He's a good boy. He should be a pharmacist. So we got to keep talking to him and see what we do. I live here in a condo out in West Jordan, my wife and I. And she was also very active with the women organization under Dean Heiner. He had the women all totally organized, and they did a lot of stuff. There's a Pharmacist magazine, and that was a long time ago. That was in the old 2 swimming pool building down on the lower campus also. I graduated in '66. I think we were the last graduating class from that building, '66. That's a long time ago. That's 1966, okay. But I have enjoyed it, and I would do it again. Absolutely would. Hope I can bring Eric, my grandson, in. That's about it.
You know, David, I'm glad you mentioned the women organization. Recently, maybe, when was it, December? Ryan and I were looking for pictures of older generations in the college, and we found how do you call them, Ryan? They are the
A scrapbook. Yeah.
scrapbook, like huge scrapbooks, like this big, with pictures and newspaper articles and everything that the women of the students at that time used to put together. So we initiated a project with the health library to scan all of that. So once we have that up and ready, we'll share it with you so you can share it with your wife.
Thank you.
I have a great picture that the Dean Heiner, put together. It's all of the students and their children.
Just the children.
Two of my daughters are in there sitting on the front row by the babies. Rich Swinier's in the picture. You remember this, Rich? He's in the picture. Dean Heiner's in the middle of everything. It's a great picture. I'll send you a
He's
copy.
in the desert news.
Yeah, it was in the newspaper. I'll send you a copy.
Yeah, we would love to have that.
It's wonderful. My wife was president of the auxiliary. That's how we got involved with that.
There might be an opportunity to recreate some then and now photos with some of these older photos. I love those, you know, if my husband's an architect, so we often look at buildings in that way, but it might be really cool to kind of look at some of those old pictures and see if we could recreate with students from today.
That would be fun.
Well, thank you all for joining us today. You know, we're
You
right.
didn't have the top, did you?
Oh, okay, yeah.
Do you
If you're
want to-
there, Steve, we'd love to hear an update from you, Steve.
Okay. My wife, Marilyn, is kind of the backbone of Panguitch, Utah. But I have something right here that you might be interested in. I'm going to let Marilyn read this.
So anyway, he just had thought about what he wanted to say. He worked for his dad at Panguitch Drug for about a year. And then we got married and traveled a little bit. And then we moved over to Cedar City, and he worked for the Skaggs store in Cedar for about 10 years. And after that, his dad was nearing retirement. So we came back to Utah and bought the store from him. So he bought the store from his dad, and then Stephen bought the store from him. And now we've since sold our store to our son, Sam, who has a lot of University of Utah students there. In fact, he's got one there right now. I noticed when I went down yesterday. So that store is actually a 4-generation store. It's one of the oldest family-owned businesses in Utah. It was founded in 1916. So I think that's pretty commendable.
Some of you would also know Evan Vickers, and he's done a lot for this.
A lot for pharmacy in the legislature. Some of the memories Stephen has are Dr. Roll. I think Dr. Roll was one of his favorite professors, and then he made a lot of lifelong friends in his pharmacy class. He loved the skiing up at the University of Utah up in Salt Lake area, and one of the fun things was that when he was a senior, the university came to him and said he couldn't graduate because he hadn't taken a humanities class. And they said he had to take that credit before he could graduate. And he just thought that he would hate it, but it turned into one of his favorite classes, and he gained a lifelong love for music and art to go along with his medical background. And he says he also remembers a lot of pranks that he wouldn't dare mention, but maybe some of you will remember them.
Doug Card has been a good friend of mine for quite a few years, and I appreciate some of the things that he does.
Hey, thank you. Yeah, it was great to hear from you, and we'll let everyone know that your son now is running Panguitch Drug, and our students are still involved with the student outreach trip that our students do down to Panguitch. So yeah, the Marshall family has been a long known pharmacy family for the state of Utah. So thanks. So anyway,
thank you very much.
Sure. Anyway, thank you to everyone for joining us with us today. And we're thrilled to be honored our 1970 class. And it was fun to have Dr. Constantine join us as well from Oregon. So thank you so much. And then also Dave and Richard for joining us today. So anyway, yeah, I think we had this was our first time doing this, so we've learned a few things, and we'll take that feedback that Scott gave us, that this is something that we really could do pretty easily, once or twice a year, and have a College of Pharmacy update that go out to your group. So anyway, thank you so much for joining today, and we appreciate Dr. Gunning and Dean Peterson and joining as well. So have a wonderful day, and if you'd like, you can use the same link at 5:30 p.m. tonight for the alumni banquet. So,
Ryan, thank you.
Yes.
Thank you.
Thank
Is there
you.
a chance? Whoops.
Oh,
Is there
go
a
ahead.
chance to get a copy of that 1970 graduating class somehow?
Yes. Yeah. I put that. I just scanned it as a PDF right now, and I'll send it out to your class. But as Maria said earlier, we're working with the Health Sciences Library, and they're going to digitize all of our pharmac utes at some point. I think it's going to take a few years for them to go ahead and organize, and we'll have a digital library. But I'll send out the one that I just did.
I couldn't find anything on the class at all.
Oh, okay. All right.
Well, great to see
Thank
you
you.
all. Hope to see some of you at the banquet this evening. Take care.
Thank you.
Thank you all. Take care.
You.
Thank you.